work in drugstores when they graduate, or are there still other fields of specialty?
A community pharmacist is responsible for controlling, dispensing, and distributing medicine. They work to legal and ethical guidelines to ensure the correct and safe supply of medical products of general public. They are involved in maintaining and improving people's health by providing advice and information, as well as supplying prescription medicines. Community pharmacists also sell over-the-counter medical products and instruct patients on the use of medicines and medical applications. Some pharmacists will also offer specialties health checks such as blood pressure monitoring and diabetes screening, run stop smoking clinics, and weight reduction programs.
Industrial pharmacy is an area of the pharmaceutical field that specializes in creating drugs and medications. Industrial pharmacies use the latest methods, technologies, and process to develop new groundbreaking medications. They are also responsible for determining if medications developed by pharmaceutical companies have both the right ingredients and the correct amount of these ingredients. It's a field in which pharmacists can make a real difference in the lives of people who use medications to treat a variety of illnesses and conditions. It's a field in which pharmacists can make a real difference in the lives of people who use medications to treat a variety of illnesses and conditions.
All large acute hospitals have an on-site pharmacy department, which has the key purpose of ensuring the patients that can receive the right medicine at the right time by an efficient and economical system. Today, most pharmacists would agree that they have a wider responsibility in ensuring that they apply pharmaceutical expertise to help maximize drug efficacy and minimize drug toxicity. Many other pharmacists adopted these important changes in pharmacy practice during the 60s and 70s. The revolutionary feature of these developments was the presence of the pharmacists on the ward. This enabled some pharmacy practitioners to become an active part of the clinical team, a practice that is commonplace today. Clinical pharmacists are ideally placed to influence prescribing by hospital doctors because they have the appropriate knowledge about therapeutics and are in regular contact with prescribers. Hospitals have adopted two main strategies to influence prescribing. These are the development of hospital policies around the prescribing process and postgraduate training of individual pharmacists to improve their skills in therapeutics and knowledge of clinical process.
Veterinary pharmacists typically work in veterinary pharmacies and may dispense medicines for all types of animals, from domestic companion animals to food or livestock animals. Generally, they need a broader knowledge of animal physiology as well as varied animal disease stages and pharmacokinetics. A veterinary pharmacist specialist may work at a veterinary hospital, a community clinic, or a veterinary pharmacy, which may be online or at a brick-and-mortar store. No matter where they work, all veterinary pharmacists need to keep up to date in government regulations and the new drugs that are on the market. Often, the pharmacist advises the veterinarian about the medicines that are available, and a pharmacist should be able to alert a veterinarian to contraindicated drugs or ones that may trigger an allergic reaction in an animal. Pet owners rely on their veterinary pharmacists to keep their animals safe. Typically, a veterinary pharmacist prepares written instructions and precautions for the client and reviews them with the client before dispensing the medicine. A pharmacist frequently uses flavoring techniques to entice the animal to accept the medicine and needs to understand the various flavorings to use for different species of animals.
The main role of hospital pharmacists is to promote the safe and effective use of medication by working with the healthcare team to ensure the selection of the best medication at the correct dose for the appropriate duration, monitoring and preventing or minimizing side effects, and drug interaction providing medication counseling to patients. A hospital pharmacist dispenses medication prescribed by doctors and often helps to determine the optimal delivery method, deciding if the medicine will be most effective through ingestion, injection, topical, or intravenous delivery. Pharmacists counsel patients on dosage, possible side effects, and risks associated with each medicine, and sometimes make hospital rounds with other medical staff to ensure that prescriptions are being properly administered. Doctors call pharmacists for advice in choosing the best medications for patients, which means they must also be familiar with the patient's medical histories. Many hospital pharmacists are also charged with administrative duties such as ordering medicines and biomedicines for the hospital, creating, maintaining, and working within a pharmacy budget, and supervising pharmacy technicians and assistants. They sometimes hire and train new pharmacists and other staff members and conduct employee reviews. They provide quality assurance, checking to make sure other employees have correct, mixed, and labeled medications and provided an accurate dose.
We dispense, we cure,
We serve.
we are your pharmacist.